Do you want to know a lot more about urinary tract infections, cystitis, bladder and water infections? We've had such a lot of inquiries that we think we're now going to spend some time answering some of those queries that you have. So hang on and we'll get going with the first one. Urinary tract infections, cystitis and the rest of them, do not cause a discharge. And you mean a discharge from the vagina, I'm sure. This is a good sign that you actually have some kind of problem in the vagina. The discharge is coming from there, and the urinary tract next door, the urethral opening, will react to that and give you what you think is an infection there, but it's actually emanating out of the vagina. So what you do if you think you've got a vaginal discharge, and certainly if you've got one alongside an attack of cystitis with it, is to go to your GP or your nurse and ask for a vaginal swab because of the discharge. You can even more quickly go to your nearest sexual health clinic. As soon as you say you have a discharge, by law, they are bound to take you and test you. A cervical polyp is up on your cervix. It's a little small growth. You can also get red patchy areas up there, and they hold on to bacteria which drip down the vagina, exit, and then find their way up the urethral opening and into your bladder. So you think you've got a UTI, and you may very well have a UTI, but it's the cervical polyp that needs attention. Individual women have individual causes of common urinary tract infections. The pill can be one of them if you don't suit it. It might not suit you. You may have to discuss and try 2 or 3 kinds of pill that suit you, because they may give you a longer, stronger discharge than you're used to. And this discharge can simply cause you to get sore and imitate an attack of urinary tract infection or cystitis. So check out your pill, which suits you the best. It is a good idea to clean up after sex. You need to pass urine, and as you've passed urine, pour some cool water down the front of you and even inside you to clean out. This helps reduce bruising and soreness and will stop cystitis, urinary tract infection, bladder, water infections. A good clean out, gently and with cool water, is a very good idea. Well, no, it's not a good idea to treat yourself, especially if you've got a test result back that says you've got a named germ, a named bacterium. You do have to take the correct antibiotic for that particular bacterium. What you do on my 3-hour management process to alleviate the starting signs of an attack of urinary tract infection, cystitis, is certainly possible, and you do need to do it. But, always the big but, take the strong urine sample first before you start alleviating your uncomfortable, unpleasant, dreadful crying symptoms.